Assalamu alaikum, hello and welcome to the Health Show here only on the Islam channel with me, Alistair Greener. Every week we're joined by a health expert within their specialist field who discusses prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, we offer an alternative viewpoint from our health experts to help guide you in the right direction. If you'd like any further information on our programme or the topics we discuss, then please do get in touch at healthshow@islamchannel.tv. Today, we're looking at counselling for mental health issues such as depression and anxiety. This is a very sensitive yet important topic, and we really want to be able to help anyone watching to make sure they realise they have a place to go. To help, it's a great pleasure to welcome our guests who are no ordinary experts, but exceptional individuals. Chamari Leelasena is an experienced counsellor, psychotherapist and clinical supervisor in the mental health care field, providing integrative therapy for clients and clinical supervision for trainees. Also joining us is Dr. Laura Fontaine, who is a fully qualified and experienced integrative chartered counselling psychologist and cognitive behavioural therapist. She has worked in both the NHS and the voluntary sector for over 14 years. Welcome both of you. Thanks so much for coming in.
Lovely to be here.
We've got lots to talk about, and we will talk to them more in a moment. But first, we're going to take a look at a FaceTime conversation between Prince William and pop diva Lady Gaga, discussing how they want to normalise mental health. This, of course, followed Prince Harry's revelation that he had sought help from mental health professionals over the death of his mother, Diana, Prince of Wales.
Hello, Prince William.
Hello, Lady Gaga.
Good morning. Well, it's afternoon there.
Yeah, exactly. Good morning, good afternoon.
The beautiful films that you've made with the Heads Together campaign, they told beautiful stories, and it reminded me how much my mental health changed my life.
I wanted to ask you very much how you found speaking out and how it made you feel.
It made me very nervous at first. For me, waking up every day and feeling sad and going on stage is something that is very hard to describe. There's a lot of shame attached to mental illness. You feel like something is wrong with you. It was like saying, this is a part of me, and that's okay.
For me, the little bits that I've learned so far about mental health was very much the case of, it's okay to have this conversation. It's really important to have this conversation, and that you won't be judged. It's so important to break open that fear and that taboo, which is it's only going to lead to more problems down the line. It feels very normal about mental health. It's the same as physical health.
We have to make the strongest, most relentless attempt we can to normalize mental health issues. So that people feel like they can come forward. Have a beautiful day.
Thank you. Bye-bye.
Bye.
Thank you again for joining us. Lots to talk about, especially with that interview. But before we get into that detail, mental health itself is a term that's been bandied around a lot. It's great that we're talking more about it. But perhaps you could help us by giving us a bit of a definition of what you understand mental health to be.
So mental health is anything to do with the mind, and when it is healthy, it's where you are thinking with your presence of mind, you can understand what is going on, you can face the usual stresses of life. You can go to work and perform well. You can, so there's basically where you're making use of your mind in a positive way. So when it is the mental illness, that is when either you are under pressure from different areas. It might be a high pressure job that you're doing, and you have thoughts of suicide. All of these things affect the mental health which stops you.
Especially in the extreme of potential suicide. But let's talk a little bit about the stigma associated with it. We heard Prince William there talking to Lady Gaga about treating it the same as physical health.
Absolutely.
Yet it's not, is it?
It's not, because, I mean, my main understanding is, well, physical you can see. The mental, emotional world you can't. So there is this stigma of, well, if there's a hand broken, you can see where the issue is. And so you don't really see a person as a broken person. They're a person with their hand injured. Whereas with the mind, because you can't see it, it's a case of the whole of your mind is not working.
That video was made as a result of Prince Harry talking about his mental health following the death of his mother, Princess of Wales. What effect has that had on the whole picture of mental health and the treatment of mental health? How beneficial has it been that someone like Prince Harry was able to talk about it?
Well, I think it's had a massive impact on destigmatising mental illness. For people, celebrities like, you know, the royal family and Lady Gaga to come forward and talk so openly about their own personal experiences of mental ill health will allow particularly younger people, I think, and people who are experiencing some type of common mental health disorder to come forward, or to even discuss it with family and friends about, well, you know what, I'm not sleeping very well and I haven't been for the past year. What does that mean? And, you know, maybe I should go and seek help from my GP and talk about that, because I didn't think it was a problem before. So I think it sort of normalises it, and it allows people to maybe even access the support that they may need as well from other voluntary and charitable services.
And we'll come to that in a while and certainly talk about the symptoms and the treatment and so on. But I just want to stay with the stigma for 1 second, because within the Muslim community, there is still quite a stigma associated, you know, with mental health. Why is that, and what can we do to help people remove that stigma?
So there is, I think, stigma and the shame, they both go together. There is shame around you not either performing well, mentally, emotionally. It's seen as perhaps shaming the family, the community, so you wouldn't actually come forward looking for help. So there are different reasons, and the different ways of understanding mental health. So some communities won't recognize certain mental illnesses, and the way they interpret these things are also different. So the how can I say, the Eurocentric model that we have within the NHS, their way of looking at mental health, and different communities looking at mental health, they're very different.
Let's take a look now at the symptoms, because you talked there about mental health. And how could someone see the difference between, say, I've just had a bad day, I'm under a bit of pressure at work and stress, to actually having a mental health condition that needs treatment, that needs help with, and how people can spot that in themselves, but also maybe spot it in someone within their family, especially maybe in young people?
Would you like to go?
Yeah. Well, symptoms some of the symptoms are very common for people with depression and without depression as well. So, for example, poor sleep or erratic sleep, poor concentration as well, irritability. Most of us feel irritable and quite cranky as well, easily annoyed as well. But if these symptoms persist over time, and if they are affecting your daily life functioning, so you're not able to go to work on a regular basis, or you isolate yourself from loved ones, or you tend to not do the usual common things that you would normally do, like a hobby or a sport, or going to seek religious or spiritual refuge at mosque or a church, no matter what your religious denomination is, then that will be seen as an alarm bells. And if I was a family member and I had a loved one going through different changes in their behavioural pattern, I would maybe sit down and say, is everything okay? How are you getting on? anything worrying
and we'll
you.
talk a little bit more about the treatment and what someone should do. Coming back to the symptoms, though, you talked there a lot about the personal side of things. What about in the workplace? How might it show up in the workplace that people might recognise?
So the performance might go down. Absenteeism comes into it. So people will just call in sick, not turn up. And they will take lots of breaks. So there are really, you know, things that will come up at work. Yeah.
And of course, the consequences for organisations, for family life, for personal life. Just give us a glimpse into how devastating the effect of poor mental health can have.
In my clinical practice, I've worked with many couples as well as individuals. And so when you work from the couple or family perspective, you do see the impact it does have on loved ones. And what I would say is that, you know, that person who's experiencing the depression feels isolated, they feel quite alone. And sometimes for the loved one, it's very difficult for them to even come forward and say, how are you? Or even offer support because they don't know how to. They say, well, you know, you'll be fine. But that person who's depressed is thinking, well, I won't be fine. You know, you think this is easy, but this is not. So no matter what support that beloved one gives, sometimes it's not seen as helpful or good enough. So this is, again, perhaps we'll talk a bit more about this later, but this is where therapy comes in quite well to help assist with dialogue of how to communicate with people. People and support people.
You said there, yeah, the complete underestimation of the problem. There's obviously lots of categories of mental health problem, and we're particularly focusing on anxiety and depression. But how many different areas of mental health issues are there? Is it a really complex subject?
It is. It is. There are so many different types of mental illnesses around there. Anxiety, depression, obsessive-compulsive disorder, relationship issues, phobias, hoarding, you know, loss of meaning and purpose in life. All of these things come under mental health concerns.
Let's come now to what to do next. So, for example, someone who's watching this show today might be experiencing something themselves, feeling that something's not right, they're not their usual self, I suppose is a stereotypical phrase that people often use. Or maybe they're seeing it in someone else, maybe a colleague at work, maybe a friend, a family member, a loved one, a child, or so on. What's the sort of thing that they can do to help that person without being too patronising or, as you were saying earlier on, being a bit dismissive?
I would suggest, I mean, what I've observed with people and people I've worked with and people I've even known in my experience is offer services support, just give them a leaflet perhaps, you know, this is, you know, somewhere that I've seen that may be able to help, have a look at it, maybe even an online link to a service, whether it's private, whether it's NHS, that might be able to help that loved one. And maybe even for some people, religious, you know, affiliations, you know, helps. Maybe speaking to an imam, speaking to their pastor or their priest, that might be a way forward before going into a more, you know, statutory or voluntary sector service. That might be a way forward, particularly if this person is quite afraid of mental health services, which is what I get quite a lot of people being quite fearful or mistrusting to want to go into statutory or voluntary sector services.
So looking at that, who should they go to? As you say, there's a wealth of people out there to help. How can someone be sure that they are going to someone who's legitimate, who's actually qualified, who can really do, for example, finding yourself, you know, how do they go about finding the right person? Well,
for me, I'm on the BCP, which is the British Association for Cognitive Psychotherapies, where most CBT, which is cognitive behavioural therapy, therapists are based. So it's like a register or a directory. So if you wanted to look for a cognitive behavioural therapist, you just put BABCP and it will come up on the internet. And you could see all the registered and accredited professionals on there.
Now, obviously, for some people, they're not going to be familiar with necessarily the terminology. So,
yes.
For example, would their GP be a good place to start? Would they be able to recommend people? Or are there other sort of overarching organisations that can maybe point people in the right direction?
There There are many different professional bodies, so I don't think there's an overarching organization that you can actually go to. But I think GP is a good starting point. They have referred clients, well, they call them the patients, clients to me. They can also have access to the IAPT service, which is improved
psychological therapy service.
Yeah, service. But that's usually CBT only. So there are ways of actually checking. BACP is another one, which I'm a member of. So if you just Google BACP and look for therapists, they are all legit as well.
Give me an idea of who's actually coming to you in what you do. I mean, is there a typical type of person? Is there a typical age group? Is it more men? Is it more women? Older, younger, different backgrounds? Who comes to you?
All different types of people actually come for therapy. And I would say at the moment, when I first started private practice, it used to be more women, and it's changed over the years. Now I've got more, well, I would say 60-40, 60% men, 40% women. Which is,
yeah, as you're saying, that's a fantastic thing, and certainly the video we saw there with Prince William, the fact that Prince Harry came forward has really helped, because of course within men it's even tougher, isn't it, sometimes to admit that they have some form of mental health illness.
Yes, so I do see people really reaching out now for help, which is absolutely brilliant.
A lot of people will be saying, you know what, I've just got to work this out myself. Or they might even be told by someone, oh, you know, check yourself, you'll be fine, you know, sort it out. What actually happens at a therapy session in terms of the results, in terms of people noticing a difference? Talk me through the process.
So when somebody comes, we will first do a initial assessment. We'll take details of any medication they're on, any specific difficulties they've had, and when they started. So we might be actually going into the childhood to gather that information, and how their problem actually keeps going. So what do they do to maintain it? And what do they want? You know, what do they really want out of therapy? So you'd have some sense of where they are, what's gone on in their lives. And so that is all coming in the assessment. We'll also do a risk assessment there as well. And then you would really offer them a safe and confidential and really non-judgmental environment where they can talk about the issues. They become clear about what's going on, you know, going from a place of being overwhelmed to fairly clear.
And some men prefer to talk to men, some prefer to talk to women, and certainly a lot of women, and certainly within the Muslim community, will only want to talk to a woman about it. Obviously, it's confidential, but what kind of reassurance can you give people that what you discuss stays there, and it's about building trust between the therapist and the patient?
It's done at the contracting stage. So I would actually have a written contract that I go through with the client, and it will include things like who, if I ever speak about any of the client material, who that would be with, and that would only be with the clinical supervisor. And again, in those sessions, you're not mentioning any names, any identifiable details. So, and also it's you maintaining that there are limits to the confidentiality as well. So you mentioned it at the beginning. If there is any harm to self or anyone else, then we need to break the confidentiality, which is the law of the land. But it is in the way that we turn up at the time that we say we are there, offer them the full session, allow them to speak, ask questions, relevant questions.
And one of the things that I'm quite intrigued by is obviously when you have youngsters,
Yes.
you know, are parents involved? What are the rules surrounding that? Likewise, you know, if there's a relationship issue between husband and wife, and if you feel actually there's a real well-being issue here, you know, what about, you know, involving the authorities? How are those kind of decisions made?
I mean, following on from what Chamari was saying, when I do a risk assessment, when we risk assess, we cover all these. So we cover, has that person got social support, family support? Are they living alone? Do they have medication at their you know, their advantage? You know, could that be an issue of overdose? Could that be a problem in the future? We also look at, you know, who's in their network as well. Maybe not people they're living with, but who do they go out and see on a regular basis? So that's all encompassed within it, really. If we feel that person's vulnerable, or may have had previous mental health engagement in the past, maybe they thought about suicide a year ago, maybe they attempted suicide 6 months ago. I've had, you know, patients like that for myself. Then we are going to be looking at developing a risk safety plan with them. You know, who would you talk to if you feel quite intensely distressed, you know, during the course of our therapy? Who could you speak to? What other services, in terms of crisis services that is, because we're not crisis services, who could you go to? And that's all part of their patient or client safety plan that we develop with them. If we feel that that person cannot adhere to that safety plan, then we would then, in our contract, in terms of the private therapy that we offer, we would then say very clearly that we'll have to seek advice from your GP. So we do ask in the contract for your GP name and contact number and address, and then we'll have to speak to your GP to let your GP know.
There's a lot involved, and obviously you are governed by, as you say, the various regulatory bodies. Yes. Finally, just for this half, Laura, because Sally, we're going to say goodbye to you for the second half, give me just a very brief outline of what it means to you to be able to help people and the level of success that you feel you've achieved.
So I've been working in mental health for over 15, 16 years now, so quite a long time. And I've set up my own clinic called Free Mind Clinic. And it's been going on for about five years now. And the people that I work with diverse people, from common mental health problems to more severe mental health problems, bipolar depression, you know, and loads of anxiety problems, OCD, trauma, phobia. And I would say that I think the crux for me, and the reason why I went into psychology as a psychologist, is just my passion of helping people and seeing someone change their behaviours, change their thought processes, doing things that they maybe even haven't done before, being more adventurous in life and utilising life effectively. I think that's really, really important. And to see that makes my day, and that's my goal as a therapist. My goal is to enable that person I'm working with to become their own therapist. So they have the tools in their box to say, right, if I'm feeling quite down or a bit low in mood, I know what I need to do to help cope with this situation.
It's lovely to finish on a positive note for our first half. Laura, thank you so much indeed for coming in. Chamari, we're going to talk to you a little bit more in our second half. We should stress at this point that should you suffer from any medical problems or have any health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. It is now time for a short break, but don't go anywhere. We'll be right back talking more about mental health and how the experts like Laura and Chamari can help. Welcome back to the Health Show, where our topic today is counselling for mental health, looking at everyday depression and anxiety that can affect a person's well-being. And for this part, Chamari Leelasena is joined by Olivia Holtman. Olivia set up her Olivia Holtman Services in 2010. With 10 years' experience in mental health, she aims to apply an holistic approach to help clients enjoy the essential benefits of well-being and healing processes. An accredited integrative humanistic counsellor, she's an eye movement desensitization reprocessing therapist, known as EMDR. Well, welcome to you, Olivia, and thank you very much again, Chamari. First of all, tell us about this amazing service that you have, EMDR, what exactly is that? How does it work?
EMDR, well, EMDR is basically an approach that uses the brain in a natural way to sort of work with a trauma. So when people go to traumas, the two parts of the brains don't work together, and that's why people sometimes get depression, PTSD. And with eye movement or the tapping, because of bilateral movement, the brain naturally brings those things together, and then you can process the trauma and you can look back in a more sort of better way without being depressed.
Fantastic. We'll talk more about that and how that is used to help people. But before we delve more in depth to that and what can be offered by our experts on today's show, as well as the types of training that they do, we're going to take a look at how survivors of a blaze at a London apartment block that killed at least 80 people are still demanding answers. The inquiry opens into the cause of the disaster, but also there's a broader subject of the mental strains that a whole community is trying to come to terms with.
I've said it is a community which is traumatised, and that sounds extreme, but it is actually true. I think that's the right word to use for the level of distress that people continue to experience. And the tower, which is so big and so raw and so horrific, continues to be a very distressing and painful reminder for many people. And the sooner the tower is gone or shielded from view, the better for everybody.
A lot of our expectations will not be met by this inquiry, and I think that's a very sore pill to swallow. It's not easy to accept, but I think it has to be accepted, and we have to continue to scrutinise this inquiry and contribute where we can and put pressure on it to make sure that the potential scope, which is quite broad, is actually fulfilled. I think it's understandable that we don't have directly affected members of the community sitting on the panel, because we will all be biased. What is disappointing is that we don't feel we've had a say in who is on the panel, and I think even though we're affected, we're still capable to identify qualified individuals who we feel represent us, and that is frustrating.
So we have little faith, but we are still going to engage with that process, and we are going to ask for to be included. We've asked to become co-participants. Let's see what the outcome of it is, but I think what we will be doing is to make sure that we hold them accountable. We will scrutinise the way they conduct this public inquiry, because we want the answers, we deserve the answers, and we are entitled to those answers.
Nobody cannot be affected by the images that they saw there. And of course, the anxiety that events like that causes manifests itself in many different ways, as we saw there on the video. We've talked so far about dealing with mental health on an individual basis, but how do you go about even approaching it on a bigger scale? When we look at that disaster, we look at what's happened in Bangladesh with the floods and the earthquake in Mexico, the terrible events of the hurricane hitting the Caribbean, and we see this all the time. How, as health professionals, do you start approaching it on a big scale? Maybe, Olivia, if you'd like to give us an idea of that.
I think it's such a big problem in the sense of, like, because the person was saying that, oh, trauma is extreme. It's totally not extreme. It is a trauma. So I would say from different levels, the government, different organizations, but also from the community itself, because it's not, as you say, an individual, and people have different needs, so they need to be sort of supported in different ways as well. So the community having forums, being aware of how this is going to affect them, but also different organizations, charities, and the government to sort of helping the community sort of build up again. So it's very complex to sort of deal with everything at the same time, but different levels definitely. And
I can imagine the effects of something like that can scar a community in an area for, you know, almost a generation, if not more.
Mm-hmm. Definitely.
You know, we see, Chamari, things like some of these disasters where there have been literally maybe hundreds of people who've lost their lives. Mm-hmm. You know, that affects generations for a long time, doesn't it?
Definitely a long time. So I really feel that, you know, there's a place for psychoeducation here of different mental health issues. People will be suffering from traumatic symptoms. Some of them would be anxiety and depression as well, post-traumatic flashbacks of being in that environment. So how to maybe train communities to look after their own community.
We talked actually about that earlier on, didn't we, about what to do if you spot some signs with somebody. And of course, this can happen on a big scale or small scale. So let's talk a little bit about that in terms of the advice that someone can give and, you know, the level of understanding. One of the things we were talking about earlier on as well was young people, where obviously they're facing this sort of anxiety that their parents would have never have had to go through. Where do you start that conversation with a loved one?
Well, you can try to approach them to start with. The problem is as well is if someone is not open to sort of speak to you about it, then no, it's nothing much that you can do in a sense as well. But giving leaflets, talking to, if you speak about young people, for example, talk to their friends, so you can see how their friends can sort of support them, because sometimes young people don't want to hear stuff from their parents, so they can hear it from their friends or from a teacher. You know, give them use social media. Nowadays, that's #1 for young people. So try different aspects of sort of approaching them if they don't want to speak to you directly.
Because that could be particularly the case with something like Grenfell or from, you know, in Bangladesh or these disaster areas where actually somebody might slip through the net, especially a child who sort of just clams up and is not really communicating. You know, how do you try to even get through to say there's support here, there's help here, you know, we can do something? Where do you start in that situation?
I think maybe school also has a role to play there. If they, you know, if the teachers can spot a child who's been really working well, and then all of a sudden they're slipping, so there will be different ways the child will be demonstrating that they're not, something isn't right. So I think there's a big responsibility for the government to include mental health awareness into school curriculum.
So looking at, you know, people on an individual basis, because ultimately it's an individual, isn't it? Everyone, you know, is affected by the events we saw on the video there in a different way. So how do you, without obviously maintaining confidentiality, but let's say maybe give us an example of some maybe younger people particularly who have come to you with their parents and have these concerns. What are the sort of ways that you will work with them?
You work with children, right?
Yeah, I work with young people more than Chamari, you think. What I normally do is I try to make that rapport with them. So, for example, if a young person is referred by a parent, I will have the assessment only with a young person and making clear that everything they say is confidential. But if the child is underage, that can sometimes be a little bit of a problem because the parent might be expecting that you're going to share information as well. So it's really trying to make that bond with a young person and so that they trust you, and so that you make them feel comfortable in the space that they're in. And working over time, they hopefully will open up, you know, to sort of say how they feel or how it's really affecting them. So it's really using that relationship, that safe relationship to sort of get to them.
I'd like to talk a little bit more now about the treatments, because obviously there's the counselling side of it, there's the listening and there's understanding. Is there any role for medication these days? Would you think about using medication, or is it a different thing, or is that in only severe cases? What do you think, Chamari?
Well, I do have clients come to me who are on antidepressants, for example, anti-anxiety medication. What really happens is when they are on that medication and we do the talking therapy, it's quite hard to see any changes they make, whether it's based on the medication or based on the talking therapy. So it's quite hard to separate that. But there is a place for medication. You know, if you've got severe anxiety or severe depression, just to bring yourself back up enough so you can engage in a conversation with a therapist. Yes.
Because obviously everyone's different, and you know we know that back in the old days, which thankfully have gone, where everyone was hidden away almost. There are still places where people can be taken, where they have extreme care, which might be residential care of some sort. Give me an idea of some of the cases that you've had that maybe have been that severe, that have needed that level of care that is beyond normal counselling and maybe a little bit of help with antidepressants.
In my practice, because it's a private practice, I haven't actually had that scenario. And let's see if you've...
There are cases where people come to talking therapy and they're on medication, and you can literally see that it's affecting them in, the daily life and also being engaged in the session. So therefore, you will have to explain to them that because of the medication and because of, they're not able to engage, or because if they cannot engage, then, you won't be able to sort of build a repertoire or speak to them about certain things. So you will have a conversation and tell them, to go back to the GP maybe and see what other support they can need and receive, and then come back when they're ready, because the medication, can have a big impact as well to them with even how they speak and how they think.
And it's always an interesting thing, isn't it, when we look at individual patients, everyone's very different, and we obviously saw the video there where that was obviously the trigger for trauma. What about other sort of less obvious triggers for trauma? What sort of things might they be that maybe people watching are thinking, oh, actually, that might explain something? What sort of things are we talking about?
So there's social media pressure. There's pressure for the young people to look thin, beautiful, successful, and so there's that pressure there. Then there's lots of other pressures like academic performance.
But also looking at people, for example, at the other end of the spectrum, we all know that mental health in old age is a massive issue and actually can lead to premature illnesses and lots of other things as well. Is there anything that you do in particular to help older people with their mental health, which might be just depression from loneliness, but it could be more than that? How do you help them? Is there anything in particular?
I wouldn't say it's specifically different for me, to be honest, when it's older people. I think you have to work maybe a little bit harder in regards of, as you said before, back in the days, mental health was not spoken about, or mental health issues were not spoken about at all. So it will be a little bit more difficult in, getting through to them, but it's just explaining, and psychoeducation might help, explaining, well, you've been through this, and this is very common what you're going through, and you can change it. You don't have to stay and live in this state.
That's quite interesting, isn't it? Because a lot of it is, again, what we started off the whole interview with, is normalising things, so that people realise they're not alone, they're not the only ones suffering from this, they're not unique in that respect.
Yeah, and the reaction is quite normal to sort of, if you look at Grenfell Tower, for example, that people get angry and that they have all those reactions. It's very normal to have that, because it would be very strange if they would be like, okay, it's all right. So for them to be like that, it's very normal, because that's how the brain reacts in trauma. So, and
how about you? How do you feel? Because it must be difficult not to become affected. I know you're professionals, and obviously, you put your professional hat on, as it were, but it must affect you sometimes.
Definitely.
Being with people who have so much, anxiety in them. How do you distance yourself and put yourself in professional mode from personal mode?
Yeah, so there are things you can do. Recognize that it is the person's story. It's coming from their world, and you also have the clinical supervision, where you will take things that have been affecting you from your work and talk about it and separate, if you like, your stuff from the client's stuff, which really gives you that energy back again to go in for other sessions with them.
Because there's so much that you cover, give me an idea of the training that you go through to become qualified, to get to the stage where actually you feel comfortable looking after people with mental health issues.
So I started with a 10-week initial counselling course. Did the level 2, 3, 4, 5. So I've got a couple of diplomas. The postgraduate is psychotherapeutic counselling course. So it does include working with clients voluntarily as part of the course. So you start maybe 2 years of that before you see a client after you've qualified. So you've got quite a bit of experience before you've qualified.
I just wanted to add as well, but maybe it's important to know, is that, well, in my training, I had to go into counselling as well. So I had to be a client as well. So also to go through my own stuff, because obviously when you sit with people, they might trigger stuff for you as well, and you don't want to react to that.
Interesting, yeah.
So going to therapy yourself is quite important. Was quite
I can imagine that's quite cathartic as well.
Yeah, very much. So, no, you know it from both sides as well, and it helps you to sort of be sure to take care of yourself, and that's also part of the training, to take care of yourself and not sort of go home and sit home and take on all those experience of the clients.
One of the things that has come out recently is that we recognise the value of mental health in terms of the positivity that can come out of it. Maybe you could both, maybe I'm putting you on the spot here, but give me a scenario of someone who's come to you and actually their lives have been changed completely as a result of having some form of therapy. Can you think of any particular stories of anybody who's really had some major benefits from actually coming out, talking about their problems, and then, you know, undergoing the therapy? Olivia, maybe you start with you.
While you're talking, I'm just thinking, because there's so many examples, to be honest. But I've worked a lot with men in mental health as well. So that part, there were some stories from men that had bad childhood experiences that they never spoke to anyone about, because as a man there is a stigma as well, an extra stigma, so to say. So coming to me and talking about it and feel comfortable to sort of speak about it, just to talk about it for the first time can be a release already. And you can see during the weeks that them talking about it, and again, them seeing that it's a normal way of feeling the anger or frustration that they had, and being able to sort of express it in a safe environment and not judgmental, they feel better and the anxiety goes down. So just by talking about it, you can see that quite quick, in some cases in a few weeks' time, that they are feeling much better, and they might be able to go deeper into their work as well because of that reason.
Because some people are scared, aren't they, of unwrapping that, you know, that's the box of problems that they've got, and they feel that if they just release that, it becomes an issue. Maybe, Chamari, you can tell us again, maybe give us an idea of the sort of trauma that someone has been through on a personal level, maybe some experiences, as you mentioned, that they had when they were young, which only manifests itself as depression later on in life, and how you were able to help.
So, just taking an example from my cases, I would say this young woman I worked with, she was in her 30s, and when she came to see me, really anxious and depressed, and had this fear of being abandoned in relationships. And she just could not shift that anxiety. So relationship after relationship failed because she was really setting herself up to be abandoned, always checking on the partners and checking their phone, and if they were late by 20 minutes, then she would be having a big argument with them. So really, it drove these people away, the very thing she was trying to avoid. And then we were working with her childhood, and it just transpired that I think her dad left mum when my client was 2.
Wow.
And it just, that knowledge itself, that insight she had of linking these two together, it just made the next 4 or 5 sessions really cathartic, where she was talking about it, and lots of memories she's forgotten resurfaced.
And I think that's the real key that's coming out of our interview today, is that people might have a multitude of different causes of their mental illness, but just talking to someone, that can really make the world of difference. So thank you so much indeed for coming in and sharing just some of your stories with us. It's been absolutely great. So there you have it, some important and really helpful advice on counselling for mental health and depression. I really hope that today's topic has been informative, and please, if you or anyone suffers from any mental health concerns, then please reach out. Never leave it undiagnosed. There are people who can help you. I'd like to thank Chamari and Olivia for coming into the show, and of course Laura earlier on, and for giving us a better understanding of this really sensitive subject. If you'd like to find out more, then please do email us at healthshow@islamchannel.tv. And once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. But for now, it's goodbye from me. Thank you, and see you again soon. Assalamu alaikum.